Good morning. The holiday season has arrived, and it's certainly bittersweet that we're here to give another update on COVID-19 in Oregon. I'm joined by Director Pat Allen of the Oregon Health Authority and Rachel Banks, Oregon Health Authority's Public Health Director. It's really tough to be heading into a time of year when traditional celebrations are once again hindered by the virus. Oregon is now well above 100,000 cases, and sadly, we've hit over 1,300 deaths. Every single family that has lost a loved one to this virus, and every Oregonian that has suffered emotionally, financially, or physically from COVID-19, I want you to know that you are in my thoughts. I know this hasn't been an easy year. I do, however, want to shed some light on some positive news. This week, we began administering vaccinations to long-term care residents and staff, finally putting us on the offense for our most vulnerable Oregonians. Since the very early days of this pandemic, one of the greatest tragedies has been the deadly nature of COVID-19 for our seniors living in long-term care. Not even our most strict policies of infection control and visitation protocols have been able to fully protect our elderly Oregonians living in these facilities. It feels really good that we are now able to start these vaccinations with the hope that these folks can reunite with their families once again and feel safe from the virus soon. Nearly 4,500 frontline healthcare workers in Oregon have received vaccine doses so far. Step by step, we are making great progress fighting this virus. I say that because in addition to rolling out this much-awaited vaccine campaign, there's evidence that our 2-week freeze and the safety measures we have taken since then blunted the virus surge we were all dreading as we entered the Thanksgiving holiday. Thanks to Oregonians respecting our safety measures and making changes to their holiday plans, we didn't see the spike in cases we feared, and as we saw following previous holidays. I hope you all heard that. Thanks to decisions you and the majority of Oregonians continue to make, we are slowing the spread of this disease. And while our case counts are still up, we are avoiding many worst-case scenarios. I'm extremely proud of us, and I hope you are too. This is proof that we determine how the next few months play out while we work to swiftly distribute the COVID vaccine far and wide across the state. So, as we did with Thanksgiving, I ask you to once again rethink your Christmas and New Year's plans. Dan and I are going to miss skating in Minnesota with my family this year, but look forward to a day filled with phone calls and Zoom calls with our loved ones. And of course, no New Year's Eve party this year. In more good news, by now, we have all seen that Congress passed a $900 billion stimulus package. I appreciate the Oregon congressional delegation's hard work in getting this package over the finish line to deliver much needed resources to Oregon families and to our businesses. This is in addition to the $800 million package the legislature set aside during yesterday's special session. I called for a special session because it's absolutely critical we get the help to Oregonians who have made the necessary sacrifices to prevent the spread of COVID-19. I am incredibly grateful to the Oregon legislature for coming together to pass policy bills that will provide relief for our tenants and landlords, will keep roofs over people's heads by extending the eviction moratorium, and support for our restaurants and bars. I'm also grateful to the bipartisan work of lawmakers to deliver on a wildfire relief package. As governor, one of the most difficult parts of the pandemic is the decision to close down our businesses and parts of our society when we have a surge in cases. It can be very difficult for Oregonians and also very necessary. But I know that even when needed to save lives, these measures take a toll on so many who are trying to provide for their families or keep a safe, warm place to call home. Both the $800 million in relief from our state legislature and the long-awaited stimulus package from Congress will be an enormous lifeline for Oregonians who have suffered so much. It will help carry us through the coming months as we continue to gain traction with our vaccine campaign. Last week, we vaccinated our first healthcare workers, and I think for that very moment, we all glimpsed that the light is at the end of this very long tunnel. As we continue to work our way through vaccinating our healthcare workers, as well as our residents and staff in long-term care facilities, we look next to the groups identified by the Advisory Committee on Immunization Practices and recommended to the CDC, including people over 75 and workers who are critical to keeping society going. One of the things I know for sure is that our educators, school staff, childcare providers, and early learning educators must be at the top of the list in Oregon's next round of vaccines. Our kids need to know they're number one, and that we're doing everything we can to get them back into our classrooms. This pandemic has shown us the hard truth that in-person instruction is so much more than what we take for its face value. School is where our kids connect with their community. It's where many kids get meals and much needed support from caring adults. It's a place of comfort, of learning, and of growth. Educators and school staff are without a doubt essential to Oregon, and getting our kids back into the classroom is crucial to all of our success. As we continue to work towards stemming the spread of COVID-19 in our communities, getting our teachers and school staff vaccinated will help ensure we are making learning environments as safe as possible. I will end once again by saying thank you. I know the mere thought of 2020 coming to an end brings a smile to many of our faces. It certainly has been a year for the books. Even in our most difficult moments, I continue to be endlessly impressed with how Oregonians come together and lift one another up during tough times. You all remind me of how special our state really is. Please, please stay safe over the holidays and as we ring in the new year. And with that, I'm going to turn it over to Director Allen.
Thank you, Governor. I want to provide an update today on the first week of Oregon's COVID-19 vaccination effort and talk to you about where we stand in the course of the pandemic. Across Oregon, vaccination against the COVID-19 virus is ramping up. Healthcare workers, vulnerable residents of skilled nursing facilities, and the staff who care for them are all being vaccinated. By the end of last week, Oregon received the full 35,100 doses of the Pfizer-BioNTech vaccine promised by the federal government. We distributed the vaccine to 16 hospitals across the state. Those hospitals all administered first doses to members of their staff who come into contact with patients and could be exposed to the virus, from nurses who provide intensive care to laundry and environmental staff who ensure that patients have clean and comfortable rooms and bedding. These vaccinations represented the first pivotal steps toward building a critical mass of state residents who are immunized against the virus, which is how we are finally going to stop its spread. I want to take a moment to thank our hospital partners for the hard work they're doing to launch this historic mass vaccination effort. As I said last week, the race to the starting line is over. How quickly we start the race isn't important, it's how quickly we end it. Administering a vaccine across hospital systems that are already being pushed to their limits by a pandemic requires careful planning to minimize any disruptions that could interfere with patient care. I appreciate the careful and urgent steps our hospitals are taking to administer vaccines to their staff as quickly, efficiently, and effectively as possible. Most of all, I'm grateful to the healthcare workers who have been heroes throughout this pandemic. It's fitting, truly, that they are the ones, by being among the first to be vaccinated, who will light the path for all of us to follow out of this dark, terrible forest that is the coronavirus pandemic. Last week, Oregon received its full allocation of 35,100 doses of the Pfizer-BioNTech vaccines. 24,375 were distributed to hospitals and 10,725 were distributed to long-term care facilities. Through yesterday, with brand new information I've just received, 4,475 people were vaccinated in our state. In the first week, those numbers included 1 person in the 16 to 19 age range and 30 people over 70 years old. Jackson County had the highest rate of vaccinations at 25 per 100,000. We've committed to being as transparent as possible about Oregon's COVID-19 information. You can follow our progress on a daily basis by going to covidvaccine.oregon.gov and looking at our daily dashboards. The weekend marked another historic development in our fight against the virus. The Moderna vaccine received emergency use authorization from the federal government, followed quickly by review and approval from the Western States Review Panel. We now have a second vaccine that rigorous, large-scale clinical trials have found to be safe and effective against COVID-19. The Moderna vaccine clinical trials involved more than 30,000 people from all backgrounds. Nearly 4 in 10 participants were people of color. The vaccine was tested at 100 sites around the United States, including Oregon. The vaccine was well tolerated. No serious health concerns were attributed to the vaccine among participants. The vaccine was found to be 94.5% effective in preventing COVID-19 infection. Because the Moderna vaccine does not need to be stored at the same extremely cold temperatures as the Pfizer vaccine, it gives us the welcome advantages of more quantities of vaccines to provide to hospitals with more flexibility in how we distribute them. We'll use the Moderna vaccines to reach hospitals and clinics that don't have easy access to the ultra-cold storage facilities that the Pfizer vaccine requires, including more rural healthcare settings. Yesterday, 12,100 doses of the Moderna vaccine arrived in Oregon and hospitals began administering it to their staff. Here's a breakdown of yesterday's totals. This is actually the brand new information I just received today. 165 healthcare workers received first doses of the Moderna vaccine. 2,408 people received Pfizer vaccines. By the end of yesterday, 7,203 Oregonians have received first doses of a COVID-19 vaccine. This week, Oregon expects to be allocated 25,350 doses of the Pfizer vaccine. 19,500 doses will be distributed to nearly 20 hospitals, and 5,850 will be distributed to skilled nursing facilities. We also expect to receive 72,100 doses of the Moderna vaccine. All 72,100 will be distributed to more than 40 hospitals and other healthcare clinics around the state. Next week, Oregon expects to be allocated 32,175 doses of the Pfizer vaccine. 26,325 doses will be distributed to hospitals, and 5,850 will be distributed to skilled nursing facilities. We also expect to receive 25,000 doses of the Moderna vaccine, and all 25,000 of those doses will be distributed to hospitals around the state. In total, by the end of this month, Oregon expects to receive a total of 92,625 doses of the Pfizer vaccine, 97,100 doses of the Moderna vaccine. At this pace, we continue to remain hopeful our hospitals and other partners can administer first doses to approximately 100,000 people in Oregon. A couple of points I do want to clarify. First, when we talk about distributing the vaccines to hospitals, that includes tribal health authorities. Tribes have been hard hit by the pandemic, and we're committed to supporting our partners in sovereign tribal nations. Second, it's really important for all of us to remember that Oregon's allocations are likely to change because our allocations are determined by the federal government. In case anyone has any doubts, Oregon wants as much vaccine as possible as soon as we can get it. We believe every adult Oregonian should be immunized against this serious and potentially deadly virus. Our goal is to vaccinate a critical mass of Oregonians to stop the virus from spreading and wrecking more lives. but we depend on our federal partners for our vaccine supplies. We are in constant communication with CDC and we receive frequent updates about our vaccine allocations. However, while those updates are frequent, they can also be surprising. This week, we learned our Pfizer vaccine allocation would again be cut, this time by over 30%, and our Moderna allocation will be reduced by 7,000 doses. We all need to understand and prepare for the fact that vaccine distribution will be a fluid and changing process as we go forward. While Oregon's vaccine allocation changes, it does not mean the state has not requested enough doses or that we failed to plan appropriately. It means that our federal partners have changed our allocation, either due to their own decisions or as a result of global or national supply constraints. That means we have to be prepared for months of limited supplies and the need to prioritize who gets the vaccine and when. But as more vaccines receive emergency use authorization, we hope supply limitations will begin to ease up. Now, as the vaccines begin to become more widely distributed, let's take a look at where Oregon stands in the course of this pandemic. Yesterday, Oregon reported 846 new cases for a total of 103,755 COVID-19 infections. Sadly, we also reported 6 new deaths, bringing our death toll to 1,347. As we've said so many times before, every death is not only tragic, it's preventable. Now more than ever, as we begin to roll out a vaccine. At the same time, I can't express how proud I am of the people of the state. As the pandemic rages across the world and across the nation, Oregonians have demonstrated that it's possible for people to adapt and to make small but significant changes, like wearing a mask or limiting your social gatherings, to save someone else's life. Yes, there are people who haven't listened, but the vast majority of Oregonians have, and you've made a difference. You've literally saved the lives of thousands of people in your community, across your state, and who knows, maybe even in your own family. And it continues to work. In Oregon, COVID-19 cases dropped 11% last week. Oregonians prevented the post-Thanksgiving surge that could have overtopped our hospital. Our state ranks 48th in the nation in COVID-19 case rates over the past week. Yesterday was the darkest day of the year, as measured by the amount of daylight. The vaccines promise brighter times ahead. But while we've been grappling with the pandemic for 10 months, we face at least as many more months before we reach that critical mass of vaccinated Oregonians that will stop the virus in its tracks. As grateful as I am for the responsible actions of so many Oregonians, we need to maintain the adaptations we've made, the habits we've learned, for a few months longer. Keep that mask in reach by the door. Keep your in-person get-togethers small and infrequent. Avoid indoor crowded places. I know it's hard as we approach Christmas and New Year's, but in a time of pandemic, we've all learned how a joyous gathering can have life-altering consequences. Don't let the memories of this holiday turn into painful regrets because of a careless gathering led to a tragic outbreak. We can enjoy each other's company without being in each other's presence. We can celebrate the season together from different locations. We can show we care for each other by keeping each other safe and healthy. Thank you again for all you are doing to stop the virus from spreading. Now let me turn it back over to Governor Brown.
Thank you, Director Allen. I think we're ready for questions. And